Good afternoon, everybody. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans, right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UVA and UVB rays, which makes skin more prone to wrinkles, melasma, and even skin cancer. We know that sunscreen is valuable from a skin cancer or sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to survey, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware and that makes us to not include sunscreen as an integral part of skincare routine. So, to keep you informed, today we are here to know about importance of sunscreen in skincare. So let's connect today with our skin expert, Dr. Swathika, live from Chennai. Dr. Swathika is the founder and consultant of Dr. Swathi's Skin and Cosmetic Clinic, a unit of DermoEar at Tambaram, Chennai. Dr. Swathika Uday completed her medical school and residency from Annamalai University. She was trained in cosmetic dermatology at Stanley Medical College under the mentorship of Dr. Late Ratnavelu. She also has vast experience of treating patients for more than 10 years. Her field of expertise is cosmetic dermatology, especially in acne scar management, and hair fall treatment, and other common dermatological conditions. A very good afternoon to you, Doctor, and it's a pleasure to have you with us for this session.
Good afternoon. Thank you for a good and brief introduction about me.
It's a pleasure, Doctor. Doctor, as today we are going to talk about the importance of sunscreen. First of all, I'd like to begin this session by asking you, because many people ask this, is it really essential to wear sunscreen every day, each day without fail? Why?
Coming to the sunscreens, the importance, as the topic is self-explanatory, it explains that sunscreen is must every day and it has to be applied and repeated 3 times a day. It's a must every day.
Okay, so it's a must. Without fail, we need to use it, apply it, and reapply it, right? So
Yeah.
why applying and reapplying every day is so important?
The thing is that every day, in olden days, the rays were not harmful as we face it today in nowadays. In olden days, they were not using the TV or mobile or laptops, or they were not of much exposure of these harmful rays. In the lights, whatever lights we are getting every day, there are various spectrums of light. That is UVA. You all would be knowing UVA, UVB, C, infrared rays, visible light, and blue light. And there are lots and lots of rays which is coming and entering from the thing into the skin and damaging it. So it's our part to protect our skin every day from all those rays, because all the gadgets have become very much essential to us in everyone's life. So those things cannot be compromised. At least we shouldn't compromise the health of the skin and the health of the individual. So sunscreen has to be applied every day, and ideally speaking, it has to be applied once in 3 hours. But for some practical reasons, we ask the patients to apply at least morning, afternoon, and evening. I ask my patients to apply half an hour before going out in the day, starting on the day, and in the afternoon around 1 o'clock, and again to repeat at 4 o'clock. So these 3 timings are must for the skin.
Fair enough. So, Dr. Swathika, now at least we know the importance of sunscreen in skincare. By what you said, I can make out that even if the name suggests sunscreen, protection from sun, but it's not only giving you the protection against sun or the harmful rays that sun is emitting, but also other sources of lights as well, right?
Yeah,
Like,
other sources which include we every day when we get up, we see the mobile, we switch on the TV, we open the laptops and start our day. So
exactly.
all those rays are highly harmful for the skin because there are three layers in the skin: epidermis, dermis, and subcutaneous fat. And in the dermal level, there is a important content called elastin and collagen. So when the skin is not protected by the proper sunscreen, there is the chances of damage for elastin and collagen are more, and that's why we tend to get the early signs of aging as well as skin damage.
Right. But people often say that as I'm not going out, I don't have much exposure into the sun, or I'm working from home. What's the use of, what's the importance or significance of sunscreen for me? But when you are saying that, even all the rays that are coming from your mobile or your laptop or other sources of lights are equally damaging for your skin, that means that even if we are indoor, is it very essential to apply sunscreen?
Yes, all the rays are harmful for the skin. As I already said, the normal light which is entering inside through indoors, the normal mobile, the now normal smartphones, what we are using now, all those emit the rays, and the smart TVs and the LED TVs, LED, LCD, all those rays are harmful for the skin.
Right. Whenever we go out buying appropriate sunscreen for our skin, we see a term abbreviation rather, SPF. Now we are always confused about what it is, what it stands for, and then some numerics are, associated with it: 30, 40, 50, 60. Now we would like to know, why we should know about these SPF levels and what should be the appropriate SPF for skin, how to decide on that.
Okay, there are lots and lots of classification about the sunscreens. The basic thing you should know about a very small point, that it should contain both a physical and chemical sunscreen. These are the two common classification, and there is also another term called broad spectrum sunscreen. So physical sunscreen is a separate component, chemical sunscreen is a separate component. When it comes to broad spectrum, why we select the broad spectrum is that it has to give protection against UVB in all the sunscreens. Even if it is a chemical individual sunscreen or a physical sunscreen, it will give protection against UVB rays. But there is also an additional component, that is UVA rays are very much harmful for the skin. So the sunscreen, broad spectrum sunscreens should contain a physical and chemical component, and that will only give protection against UVA, UVB, infrared, and all these blue light. Blue light, nowadays it's very common because blue light is coming from the laptops, the mobiles, and the hair dryers, what we are using, the heat we get it from that. All those things are emitting blue light. So all those things are highly harmful for the skin. And this SPF, what you asked is that SPF, which means that sun protection factor. Sun protection factor is that minimal erythema dose of photoprotected skin by minimal erythemal dose of unprotected skin, which means that in normal terms, what we have to say that SPF around 15 will give around 93% of protection, whereas SPF around 30 will give around 97% of protection against UVA, UVB, infrared and blue light, all those rays. So the SPF 30 is ideal for the Indian skin pattern. It doesn't mean that the higher SPF, if you go around 60, 70 or even 80, some people will come into the clinics and say, I use a higher SPF and why should I repeat it? It doesn't mean the higher SPF you needn't repeat it. It's a misconcept actually. So the normal 30 SPF, 30 to 50 is essential for Indian skin. It has to be repeated at least 3 times in a day. Then only SPF will be maintained. That is sun protection factor. It will give protection against all these rays. And next comes substantivity, which means that how much time the sunscreen gives protection to your skin. That also is important in a sunscreen, what you have to note. As I said, if it is around SPF 50, it gives around 97 to 99% of skin protection, which will last for around 5 to 6 hours. After that, you have to repeat it. So the repetition is very important. It doesn't mean that single time application alone will give you the complete protection. The repetition of the sunscreen is also very important to maintain the effectiveness.
Right. So SPF, as Doctor just explained, it's the sun protection factor, and 30 to 50 SPF is good enough for Indian skin or the conditions we are in. Doctor, I would also like to ask you how much quantity of sunscreen should we apply on our face or whatever, body part is exposed to the sun. Many people say they have this 2 fingertip thumb rule, or they have this a coin size of sunscreen rule. So how should we actually, judge that how much quantity is required?
Yeah. The thing is that the fingertip, 1 fingertip unit is from this part to this region. It covers, when you take the sunscreen in this region, you can cover about palm size part.
Okay.
This is the normal measurement what everyone can do. So I usually tell my patients to take twice.
Okay.
So once you apply covering up to the neck, and you have to cover the ears and even behind the ears. These are neglected parts. So yes, you have to apply on the ears and behind the ears, covering the neck and behind the neck. So I ask my patients to take it twice and then apply it and cover the entire part. When I ask them to take it twice, that includes face, neck and back of the neck. And again, for the exposed parts for the hand, coming to the upper extremities, that includes another 2 more things. 1 fingertip unit for one hand and another one for the next hand.
Okay.
This will be my measurement for my patients.
Fair enough. At least now we know that sunscreen is very essential. Every day we need to apply sunscreen, not only just once, but at least thrice. And 30 to 50 SPF is good enough for our skin. Doctor, I would also like to ask you, because many people complain that, there's so many sunscreen and so many formulations are available. We have gel, we have lotion based, we have a spray sunscreen, and people are really confused what to choose. So are there any, criteria that as per my skin type, a certain sunscreen or formulation would be good enough?
Okay. As I already said, sunscreen is a combination of both. That only will give you complete effectiveness, physical and chemical sunscreens. In physical sunscreens, there are certain components like titanium dioxide, zinc oxide, like that. All those things are a little bit responsible for this oiliness also. And this oiliness is also very much essential for skin protection. So to overcome that, in combination with chemical sunscreens, that will give you good results. Coming to the skin pattern, normally in normal terms, other than the dermatological classification, we have normal skin, oily skin, dry skin, and a combination of both.
Right.
So for a normal, for a oily skin, gel-based sunscreens will be ideal. So when you choose a sunscreen, it should be non-comedogenic, water resistant, and a gel-based sunscreen for oily skin.
Okay.
For a dry skin, even the lotion or creams or sprays will be of much use. In addition to that, they can apply a moisturizer below that, and then they can apply the sunscreen on top of it, which will be highly useful to overcome the dryness. For combination skin, that is for some time in the around the when they have combination of dryness and oiliness, both the sunscreens will fit in for them.
Right. So as per our skin type, we can choose the appropriate sunscreen for us.
Yeah.
Okay. And as children or kids have a lot of exposure both under the sun and in front of the devices, etc., which emit harmful rays. Now, is it okay to use sunscreen for children or kids? Is it safe?
Yes. Sunscreens, we have come to a concept of using sunscreen for kids after 6 months of age.
Okay. Yeah. So after 6 months, we can put sunscreen on our kids.
We have to use, and particularly for the kids whom they are going for swimming or any other extracurricular activities, they have to be protected because no one can stop the activities. The skin has to be protected basically. So they have to apply the sunscreen half an hour before starting any activity, and then they can go on with it.
Right. As you just mentioned, doctor, that kids often go for swimming or playing, they sweat a lot, and there are chances that the sunscreen that they have applied is going to sweat out or wiped out. Now, especially for the kids or even adults who go for swimming, what should be the criteria when they are choosing the best sunscreen for them? Because again, as you said, water resistant sunscreens are there, but are there any specific sunscreen for people who go swimming or underwater, etc.?
Yeah. So the sunscreen, there are actually various types, that is waterproof, water resistant, sweat resistant. So it will be mentioned on the packing itself that this is sweat resistant. You can see it will be written that sweat resistant, non-comedogenic, and water resistant. It means that after application of sunscreen for 2 or 3 seconds, you will feel that sweat has increased and you would feel that it's going to wash it out. It doesn't mean like that. It will absorb even after perspiration, and it will be uniformly, it will be giving protection for the skin. So you needn't be worried that sweating will wash off the sunscreen, that swimming will wash off the sunscreen. It doesn't mean like that. So it is a water resistant sunscreen and waterproof sunscreen. Water resistant sunscreen is that even for around 3 to 4 hours, around 4 hours, that sunscreen will give you protection against all the rays, and including your chlorinated water. And waterproof sunscreen is that around 8 hours it will give protection.
So we can choose sunscreen as per whatever our work or activity area is like, and as for that we can go and choose the best sunscreen. Doctor, another thing is, as you said, many times when we apply sunscreen, there's a little bit of sweat that happens. Many times people complain that I get acne or I get tan or I get a very patchy and sweaty feel when I use sunscreen, and thus they end up not using sunscreen on a regular basis. A study, as I mentioned in the introduction, that shows that 67% of Indians are still not using sunscreen, despite knowing that the weather conditions here are very extreme. We are exposed to the sun, excessive heat, etc., humidity. How to address all those so-called excuses that people have, or whatever their experiences were? How do you address that?
Okay. The question is that people try to avoid using the sunscreens. Now, the thing is that what the practical point is that in olden days, no skincare routine will be needed. They just take bath and just wear the dress and go off, and no need of any skin routine and all. So no harmful rays and all were there at that period. But in the recent years, as the technology has developed a lot, we are exposed to a lot of rays. By the time people understand that skin has been damaged and the hyperpigmentation has increased, acne has increased, skin glow has reduced, the skin is not in a proper way. By the time they realize, the damage would have reached to a very high level. So when they enter the clinic, we have to give the sunscreen, and we will not give the assurance that it will not be oily and all. It will be oily initially. You will notice dullness because the damage has already occurred. So you have to come out of the damage. You have to give some time for the elastin and collagen substances to get replenished. For that, without stopping, you have to apply the ideal sunscreen for your skin, and you have to wait around 15 days or in approximate 15 days or 20 days. You have to wait, and after that, you can see that all the cells have been replenished, and you can see that the sunscreen has matched with your skin, and that after that, it becomes a routine.
Right.
So we have to wait a little bit for the things to replenish and regenerate.
And the weight or whatever we are going through is worth, because ultimately we are giving life to our skin. We are protecting our skin from the damage of all the lights or rays we are exposed to. So the weight is worth.
Immediately when you apply, you can't expect the results of that. Skin has to be protected from day one itself, and from day two itself, the glow has to come. You shouldn't expect. Give some time for the skin to regenerate. Apply the sunscreen properly at 3 times a day. If not, at least 2 times a day. And after 2 weeks, you will see the result that skin is starting to grow again, regenerate again, and you will see the differences.
Exactly. So for all those who have not yet started using sunscreen, or have not, taken sunscreen as the integral part of their skincare, please start from now, from today. Just go get the best sunscreen as per your requirements, as per your skin type, and wear it each and every day. Reapply it at least thrice a day. I'll also take some of our viewers' questions, Doctor. Kajal Malviya is here asking, what are the most important parts of a skincare routine?
Skincare routine. What I usually tell my patients is that simple things to be followed. Sunscreen in the morning and moisturizer in the night. A proper face wash.
Okay.
A general usage face wash. And if the patient is having acne, a salicylic acid preparation face wash morning and evening. This is the simple skincare routine which has to be followed.
Exactly. So no matter how busy you are, how much work you have, at least you can take out some time to clean your face, to apply sunscreen during the day and moisturizer in the night. Now, a question rises, doctor, because many a times, we have moisturizer or makeup products claiming that they also have SPF or sun protection factor. Now, do we need to get a standalone sunscreen, or we can actually go with those products which have sunscreen, sun protection factor in them?
Usually, I prefer medicated sunscreens
Hmm.
rather than the products which has been sold out, because it is scientifically proven that this medicated sunscreens have the proper SPF and booster rating, that is PA factor, that is protection against UVA rays, will be around 3 to 5, 3 stars or 5 stars.
Mhm.
So that is a ideal sunscreen which has to be used by an individual.
Exactly. So we have medicated sunscreen, so we can go for that. Is there a need that we should actually go to the dermatologist and they'll suggest us as per our skin type or our work conditions, etc., our exposure, etc., that which sunscreen is actually going to be beneficial?
Sorry, I couldn't get you. Can you repeat
Yes,
it?
I mean, I'm asking that do we need to go and consult a dermatologist before choosing the sunscreen, or we can do it on our own?
Yeah, it would be ideal if you come to us and we will guide you that when sunscreen has to be applied, and we will tell you which skin type are you. Most of the Indian skin will be around type 4 or 5 and
Okay.
very rare around 3. So we will tell you how to choose a sunscreen for your skin and how to continue, and whether a moisturizer is needed at the base or not,
Okay.
and a moisturizer in the night, which includes acne based. For people who are having acne, will have acne based moisturizers. All the moisturizers are not ideal for acne prone skin.
Okay.
So there are different sunscreens, as I already said, for oily skin, for normal, a combination of skin, for dry skin, and
Mhm.
even the moisturizer has to be guided, and it has to be told to you which moisturizer has to be selected.
Okay. So it's always a good idea to go and consult a dermatologist and choose the products, skincare products, as per their advice. We have Ankit with us asking, how can I get rid of blackheads?
Blackheads.
Yes.
Yeah, comedones. You're asking about comedones, right?
Mhm.
Yeah. There are open comedones and closed comedones. There are either you can use a salicylic. You have to use a salicylic acid face wash morning and evening, and you
Okay.
have to make a mild massage, either foam based face wash or a gel based face wash, and you have to make a mild massage, and then you can wash it off in 2 to 5 minutes.
Mhm.
And after that, if you're not fine with it, you can also use a comedone extractor by yourself, or you can come to us. We'll extract and remove it.
Okay, so you have your answer, Ankit. We have Sonam Rai with us, doctor. She's asking, I have a very acne prone skin. How should I get it treated without completely drying out, especially in the rainy season?
I have acne prone skin. After that,
How should I treat it without completely drying out, especially in the rainy season?
okay. First, uh, if the people is having active acne,
Mhm.
first it has to be treated. Anti-acne preparations in the form of tablets and creams have to be given in the night, and in the day, sunscreen is a must. One thing.
Okay.
So the anti-acne preparations will be given in such a way that it won't produce extreme dryness, and the sunscreen is essential for not the skin has to be protected, and so sunscreen in the day and anti-acne preparation in the form of tablet and creams in the night.
Correct. Please consult your dermatologist, Sonam, because they'll actually, suggest you for whatever, tablets or creams, etc. as needed. Don't go for over-the-counter medication or self-medication. Please go and consult dermatologist. If you are based out of Chennai, you can go and contact Dr. Swathika. We have Danish Ansari. asking, what is the best way to minimize acne scarring? Now, acne scars are again a big trouble for people. So how to minimize them, and do sunscreen play a role in that?
Yes, coming to the acne scarring means it is the end part of acne. Actually, to say it is the end part of untreated acne. When people enter with active infection, it is easy to treat and people don't end up in scarring. When they don't realize that acne has to be treated and leave it as to heal on its own, they end up in scarring. So when they end up in scarring, there are certain procedures which has to be done in the form of microneedling, radiofrequency, CO2 laser, subcision, derma roller. All those procedures are needed for correction. With that, we have to give sunscreen.
Okay. So
Sunscreen
again, yes.
will be given in all the conditions. So coming to the acne scarring, procedure will be done. With that, sunscreen will be provided.
Right. So sunscreen do plays an essential part in even treating acne scars. Please consult your nearest dermatologist, Danish. You'll get rid of those scars. Himani is asking, what type of lifestyle changes to be done for skin, especially during rainy season? Now, this rainy season, again, due to fungal infections or due to all the humidity, etc., people are really troubled about their skin.
Yeah. Coming to the rainy season, people would be thinking that it's already raining. What is the need for me to apply the sunscreen? Why should I apply sunscreen? As I already said, even if it is raining also, the intensity of rays will not reduce. All those rays will be coming and it will be entering and damaging the skin. So, as I already said, all these gadgets we'll be using even during rainy season. And in the rainy season also, these rays will be entering the skin and it will be damaging the skin. So, the sunscreen has to be used even during rainy season also. Only the humidity level will increase and an additional care of moisturizers plays a very important role during rainy season.
Right.
So
even if
during
it's
rainy season, it doesn't mean that you shouldn't apply sunscreen.
So even if it's raining or it's cloudy, you should use sunscreen, right?
You have to apply sunscreen even if it is raining also.
Okay, fair enough. We have Suman Yadav with us asking, how does UV exposure impact our skin?
UV exposure. Yeah, that's what I already said. There are 3 layers in the skin: epidermis, dermis, and subcutaneous fat. In the dermal level, there is a substance called elastin and collagen. There are these 2 cells play a very important role in the skin for the skin glow, laxicity, everything for the skin to be maintained. All these 2 substances are the key ingredients. So when you get exposed without the sunscreens, this elastin will be damaged. So as the name indicates, this elasticity of the cells will be lost. The collagen breakdown occurs. If the collagen breakdown occurs, there are certain substances called free radicals. Free radicals are like sewage materials, that is like unwanted substances which is being released into the skin. They are responsible for premature aging of the skin, wrinkles, fine lines at an early age, hyperpigmentation, laxity of the skin. All those things occurs because of those damage.
Okay. Doctor, we have Priyanka Rajput. She has a very oily skin and is asking, how can I reduce the oil production in my skin?
Yeah, oil production, you have to select a sunscreen which contains a matte finish or gel-based sunscreen in the day, which includes 2 to 3 times per day application. And in the night, anti-acne preparation, which will be around a basic preparation of clindamycin with nicotinamide, and a face wash, which contains salicylic acid 2% at least. So these three things can be followed, and if it is not responding, you can come to us and we'll see to that.
Okay. Keshav Soni is asking, though we have discussed it, but then many people are asking the same questions as I'm taking his question. It's, since I lead a very busy life, I need to keep my routine really simple, skincare routine. What are the absolute skincare basics? You have already explained it, doctor, but would you like to, go through it once?
Yeah, I would like to repeat also.
Yes.
A basic and a very simple regime for skincare is that sunscreen in the morning and afternoon and evening 3 times a day, and a moisturizer in the night while going to sleep, and a normal face wash. If the person is having acne prone skin, the night regime will vary around anti-acne preparations in the form of tablets and creams, and the face wash should contain salicylic acid preparation 2%, whether in the form of foam or gel or spray, whatever it is. This is the simple routine, and these are the 3 components that have to be used in each and every skin.
Okay. We have Rishita asking, how can I fix an uneven skin tone with the help of sunscreen?
Yeah, uneven skin tone itself is an indication of lack of sunscreen.
Okay.
There is an entity called polymorphic light eruptions, PLE, or photocontact dermatitis, which means that the skin tone is uneven. That is altered hypo and hyperpigmentation. That is, there will be some white patches seen over the skin. There will be some darkness, scattered darkness over the alternating with white patches and dark patches. This is the meaning of the uneven skin tone. This indicates a lack of proper skin care. So you have to apply a proper sunscreen 3 times a day, at least 2 times a day, and a moisturizer in the night, and that will even give you a proper skin tone, a normal skin tone. After that, we'll take it.
Right. Saloni is asking, why not just cover up with clothing instead of using sunscreen? Because many people prefer covering up their face with a cloth of, cotton or a scarf, or put a hat or cap. Is it equivalent of using a sunscreen?
Clothing will not give you protection against UVA or UVB or infrared or blue light rays, and it will not penetrate up to the dermal level. You have to use a sunscreen. Besides that, there is a myth also that you can cover the face with the clothes. When you cover the face with the clothes, already the skin is lacking a proper skin regime, that is lack of sunscreen. When you when you cover it with the clothes, when you're walking or going in traveling anywhere, that friction itself will increase the skin damage. So it's not ideal to use a clothing instead of sunscreen.
Right. So you have your answer, Saloni, and plus, because it's just not the sun or the other light sources like the mobile or laptop you are in front of, the other gadgets that you are using, the LED lights that you have at your place or at office, they all emit harmful rays, and those rays are really bad for our skin. So you can't cover up your face and the whole body all the time, plus it's not giving you full protection as well. So please avoid those and go for a good quality sunscreen as per your skin type. Rohini is asking, should I take any vitamin supplement to beat acne?
Actually, coming to the vitamins, not only vitamins, the supplement, that is zinc, plays a very important role in acne. Zinc helps in healing acne, and it has a lot of indications in dermatology, dermatological conditions. So zinc taking a zinc tablet is very important for skin condition.
Okay. Mohit is asking, what is the difference between physical and chemical sunscreen?
Yeah, physical sunscreen, it is a mineral sunscreen. So physical sunscreen is limited, that it will give only protection against few rays alone. Whereas chemical sunscreen is highly suited for the period what we are now, because the rays have extended of various wavelengths. So the difference is that physical sunscreen will be very much oily. It will be giving you a lot of dullness, and it will induce certain acne-form eruptions, like that. Whereas in chemical sunscreens, you won't be noticing all those effects will be overcome by these chemical sunscreen. So ideally speaking, you shouldn't use a physical or a chemical sunscreen. You have to use a combination, that is broad spectrum sunscreens.
Okay, so please go for a broad spectrum sunscreen. Geeta Sharma is asking, doctor, can I get a higher SPF by adding the SPFs from 2 different bottles?
From 2 bottles.
Mhm.
No, that's not possible actually.
Mhm.
That's
So
not,
the 2 plus 2 calculation of mathematics won't fit here. So
no,
don't do
that
that.
won't
Go and
help
get
you.
a separate bottle of sunscreen
Yeah.
with 30 to 50 SPF that is suitable for our skin. Palak Dubey is asking, how can I avoid wrinkles with sunscreen?
Yeah, wrinkles. As I already said, these two substances, elastin and collagen, repair occurs with the help of sunscreens. When those cells are regenerated, that will try to overcome the wrinkles and fine lines around to some extent. According to the age, there will be aging process going on. Due to the lack of proper skincare routine, premature aging occurs. So that's why we insist that you have to use sunscreen to control the fine lines and wrinkles.
Okay. And as in India, pigmentation or melasma is also very common, especially in women. Doctor, again, for that, is sunscreen the best way out? I mean, applying sunscreen can prevent us from having pigmentation or melasma?
Yeah, sunscreen plays a very important role in melasma because the melanin deposition occurs in the dermis. The quantity increases. So when you apply the sunscreen, the deposition will be reduced, one thing. Next thing is that we have to rule out certain underlying causes for melasma also, that is overusage of cosmetics. And we have to look for certain conditions like thyroid profile, and we have to rule out anemia. Melasma doesn't mean that the pigmentation is externally alone. We have to rule out some basic causes like anemia and thyroid issues, and then we have to treat it with depigmenting creams in the night. And as I already said, sunscreen is the main component in the day. There is no change in that.
Okay. And Dr. Swathika, as we are moving towards the conclusion part of this session, any takeaway message for our viewers? Anything that you would like to share with us?
Yeah, exactly. As I already said, a simple skincare routine every day. Apply the sunscreen which is being recommended for you 2 to 3 times a day, and a moisturizer in the night, and a face wash.
Right.
Don't overload the skin. Allow the skin to breathe, as well as it has to be protected. One thing. Then coming to the home remedies part, application of turmeric or sandal or any other things. As in olden days, the problem is not with the product, what we are using. It's with the atmospheric things what we are living. So these rays cannot be stopped or changed. No one can change all these things. Only the technological part will increase more than this. So when you do any home remedies without our advice, without dermatologist advice, you tend to damage the skin more and you're creating way for the skin damage more. So
Oh,
basically don't do any home remedies. Just follow sunscreen in the morning and moisturizer in the night and with a face wash.
right. So, have that simple skincare routine, use sunscreen regularly, no, excuse for not using sunscreen, and take care of your skin. Before we wind up, one final question, because it's a very interesting question and many people ask it. Sarvati Khatka is asking it here. If I wear sunscreen often, can I get a vitamin D deficiency?
Yeah, this is actually a controversial one. Vitamin D deficiency does not occur with the help of sunscreens because vitamin D is already synthesized by the skin, as we already know. We are going to apply the sunscreen half an hour before going out.
Right.
So ideal time of exposure to sunlight would be around 7 to 8.
Mhm.
So after 8 o'clock, I would recommend to apply the sunscreens. So vitamin D deficiency will not occur with that.
Okay. So again, it's a misconception. No interference with your vitamin D, that you take from the sun. Your sunscreen is not going to hamper that. Thank you so very much, Dr. Swathika, for your valuable time. It was a very informative session. And again, I would like to say that it was a pleasure to have you with us for this session.
Thank you.
We really look forward for many more such sessions for our viewers in the coming times. Thank you once again.
Thank you. Thanks a lot.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.